If you read the nation's newspapers or listen to politicians, they will tell you that we've got to, quote, bend the cost curve. And what that means is dramatically reduce the rate of increase in health spending so our nation's Medicare program doesn't consume the entire federal budget. The reality is that the cost curve, that is the rate of increase in health costs, actually bent downward 11 years ago in 2003, and by 2009 reached a level of 3.9%, which is the lowest rate of increase in health spending since Dwight Eisenhower's last year in office, and has stayed at that Eisenhower pre-Medicare level for the last 5.5 years. I believe that is a sustainable rate of cost growth. It's barely more than the inflation rate plus population growth, and I do think that health cost constraint is becoming a permanently ingrained feature of our healthcare landscape. A major reason for this is that we've shifted a huge amount of economic risk that was formerly borne by the employer onto patients and their families. And patients and their families are making a lot more conservative decisions about how they use healthcare. We've also seen, I think, and this is not as good news, a significant pause in technological innovation and pharmaceutical innovation that is not serving our nation as well. We really do need to begin changing how care is provided to people and to encourage new technologies to be adopted more aggressively. I believe health costs are going to continue to rise at a much lower rate than they have for the last 40 years, for perhaps the next decade.